There's been a lot of talk about a virus called HMPV in China. This virus has been making headlines recently due to its widespread impact and the number of people it has affected. But what exactly is HMPV and why is it causing so much concern? HMPV stands for human metapneumovirus. It's a respiratory virus that was first discovered in 2001. Since then, it has been recognized as a significant cause of respiratory infections worldwide. It's a virus that causes colds and coughs. HMPV is very common. Symptoms can range from mild to severe, including runny nose, sore throat, cough and fever. In some cases, it can lead to more serious conditions like bronchitis or pneumonia, especially in young children and the elderly. Almost everyone gets it at some point in their lives. It's estimated that by the age of 5, nearly all children have been exposed to HMPV. This widespread exposure means that most people develop some level of immunity over time. Most people get HMPV when they are young children. Daycare centers and schools are common places where the virus spreads rapidly due to close contact among children. HMPV spreads easily from person to person. It can be transmitted through respiratory droplets when an infected person coughs or sneezes. It can spread through coughs and sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It can also spread through touching surfaces that have the virus on them. Common surfaces like doorknobs, elevator buttons and handrails can harbor the virus, making it easy to pick up and spread. The good news is that HMPV usually causes mild illness. Most people experience symptoms similar to a common cold and recover without any complications. Most people recover quickly with rest and fluids. Staying hydrated and getting plenty of rest are key to a speedy recovery. In most cases, no special medical treatment is needed, and people can return to their normal activities within a few days. There have been more cases of HMPV than usual in China recently. This has raised concerns among the public as people are worried about the potential impact on their health and daily lives. The virus, which is known to cause respiratory issues, has been spreading more rapidly than in previous years. However, health experts say there is no need to panic. They emphasize that while the increase in cases is notable, the situation is under control. Medical professionals are well prepared and have the necessary resources to handle the outbreak effectively. Doctors in China are keeping a close eye on the situation. They are continuously monitoring patients and ensuring that those affected receive the best possible care. The healthcare system is on high alert, ready to respond to any developments. They are testing people for HMPV and tracking how the virus is spreading. This involves extensive testing and data collection to understand the virus's behavior and transmission patterns. Laboratories are working around the clock to analyze samples and provide accurate results. Health officials are reminding people to take steps to prevent the spread of HMPV. Public health campaigns are being launched to educate the community about the importance of hygiene and preventive measures. These efforts are crucial in minimizing the virus's impact. These steps are similar to the steps we take to prevent the spread of colds and flu. Regular hand washing, using hand sanitizer, and wearing masks in crowded places are all effective ways to protect oneself and others. By following these guidelines, we can help reduce the transmission of HMPV and keep our communities safe. There are simple things you can do to protect yourself and others from HMPV. Wash your hands often with soap and water. Cover your mouth and nose when you cough or sneeze. Stay home if you are sick. If you are worried about HMPV, talk to your doctor. HMPV, or human metapneumovirus, is found all over the world. This virus is not restricted to any particular region or climate. It has been detected in various countries, affecting people of all ages and backgrounds. It is not a new virus. In fact, HMPV was first identified in 2001, but it has likely been circulating in human populations for much longer. Historical medical records and old journals suggest that similar respiratory illnesses have been observed for decades. Health experts are not surprised to see an increase in HMPV cases in China. This trend is consistent with patterns observed in other countries. Experts regularly monitor such trends and are well prepared to respond to any changes in the virus's behavior. This often happens in the winter months. Cold weather can lead to an increase in respiratory infections, including HMPV. People tend to spend more time indoors, which can facilitate the spread of viruses. The World Health Organization is monitoring the situation closely. They are working with health authorities around the world to track the spread of HMPV and provide guidance on how to manage and contain outbreaks. However, they do not believe that HMPV is a major threat to global health. The virus typically causes mild to moderate respiratory illness, and most people recover without needing medical treatment. Remember, HMPV is a common virus that usually causes mild illness. Symptoms can include cough, fever, and nasal congestion. In some cases, it can lead to more severe respiratory issues, especially in young children, the elderly, and those with weakened immune systems. By taking simple precautions, we can help to prevent the spread of HMPV and other respiratory viruses. Regular hand washing, wearing masks in crowded places, and practicing good hygiene at home are effective ways to protect ourselves and our communities.